Trên làm
Oh, okay. Okay. Okay, so we did talk about some of the principles from this earlier, so we hopefully can skip through a little more quickly. And because we've already, got introduced and we know some of the baseline, we've covered a little bit of the early. So what we're going to do is just talk about some of the benefits of planning learning. So as right at the beginning when we talked about what makes a good teacher and a good learner, the planning and the preparation was obviously was kind of on both lists, and I think that's partly why this is such an important one, because it's important from both sides to be prepared. So we talk about how we would build a learning plan, problem solve some challenges with implementation, and recognise the value of learning outcomes. We won't go through the detail of developing them, but just the importance of why we need them. So what I'm going to do first is, well, this is where I want the extra person just to split. So this is a little activity. I'm going to ask half of you to look away in a moment and not read the next slide. And then there's going to be some phrases that come up, and I'd like you to try and remember as many of the phrases as you can without writing them down, and then we'll try and recall them a little bit later. So just here waiting here. What I might do is, because we'll just do it with 5, I think, because otherwise I'll run ahead. So maybe
2 of them and 3 of us.
Yes, 2 of them and 3 of you. I'm just thinking of which group I put in the other. Doesn't matter. So maybe you 2 look away for a second. Look out the window for a moment.
There's a picture from outside. I like it.
Away from the screen, or close your eyes, or whatever.
You don't need to go away.
You don't need to go away. Just close
Just
eyes.
close your eyes.
Just close the eyes, okay.
Okay, so no, I haven't done it yet. So close your eyes, and then for one moment I will show. Okay, that's it. Close your eyes. Okay, so you 3. No, don't look. So you 3, read this for me.
Okay.
So you understand the context. Okay? Alright, now, both of you can open back up your eyes. Oh, here we go. That's okay. What I might do is, she hasn't seen it either, so we'll go with that. So she hasn't, I'm about to show, and so these 3 have just seen a piece of information, which these 2 and yourself have not seen. But the task now is to try and remember as many of the phrases that pop up as you can. So don't write them down, just try and remember them. So, the beach is a good place.
I continue to close the eye.
Oh, so you can open it now. So, okay, so we'll go back. So now you can look. So now everybody's looking. Everybody's looking and trying to remember. So the beach is a good place. Structure gives strength. No wood when it rains. Learn to solve problems. Okay? Children love it. Okay. We're going to come back to that, and you'll understand more about what that was all about. But what are the benefits of having a learning plan? So you've had a look at the online module for this and seen the template, the learning plan template. So and read the actual teaching on the run for this. This is just, if you've got your copy, you can pull it out, but this is just so that you can refer as well. So the teaching on the run module has us having some discussion in pairs, but I think we can just keep with the group and just discuss. So in terms of the benefits, particularly if we were to think about both teaching and learning, we'll go through this. So some of the benefits that we talk about, and I thought these were going to come up one at a time, so they've all appeared. What we might actually do is, So we talk about the goals and objectives. So obviously, again, coming back to what we talked about earlier, the need for a learner to know what they're doing is I think really clear. But also for a teacher to know what you're trying to achieve. If you said to me, go and teach some students, or you've got an hour with some second year students today, well, what do you want? What do they need? What do you want them to achieve? So we need to understand what the level is. It helps give that guidance. One of the clearest examples for me, and remembering that teaching on the run is mostly about clinical teaching and bedside teaching, these are the experiences that our students share when they first go into placement. So the students that I'm going to go and see at the hospital today, when they share that when they first go to placement, they're with a different team, they don't really know what their role is, they don't know what they should be doing, what they should be getting out of it. So being really clear about that is part of that learning plan. By doing that, you can then help develop their confidence and competence. So as a learner, to just go in and feel blind, not knowing what you're trying to achieve, can be quite scary. But if you give them some framework, it's about developing confidence and developing confidence at the right level as well. So understanding, giving them an opportunity to succeed. So coming back to that challenge and safety. So we want to provide an appropriate level of challenge, but also that appropriate level of safety. Clinical placement can feel really scary and unsafe for students if they're being put into a position where they are asked to do things that they don't feel confident with, or that they haven't had enough practice in, or that they don't quite know what they should or shouldn't be doing. So a plan and a structure provides that sense of safety, which can then in turn allow them to be challenged at an appropriate level. It provides varied exposure in terms of making sure that if we think about a learning plan, well, instead of, if you were to map out a plan where you said, okay, I've got a student for 5 days, on day 1, we'll do this, and then on day 2, we'll do the same thing, on day 3, we'll do the same thing, you might think, well, actually, we're not spiraling, we're not increasing, we're not doing anything different. We need to think about how we can structure this to, increase the challenge, I guess, as we go through. So that's about that varied exposure, trying to think about, well, if I've got this breadth of learning objectives, let's try and vary some exposure to make sure I give them opportunities to address different learning objectives in different ways and in different contexts. It also promotes accountability, and that's from both the learner and the teacher as well. So you've got that sense of what, and you all said this at the beginning as well, in terms of what makes both a good learner and good teacher is about understanding expectations. And I think that allows accountability. So if right at the beginning there's a clear plan of this is what we're trying to achieve and who is responsible, that's something that's part of this learning plan, is who's the actual responsible person. A lot of the time it might be the learner, but a lot of the time it might be that a different educator has to be involved in enabling some opportunities, and that's something that's really important to clarify as well. So that can be, again, like this is on the learner side, but really it fits into both. A lot of the accountability does lie with the learner, and being really clear about what tasks are required when allows that. But like I say, some things need to be supported. On the side of the teachers, obviously it's time management. So I could, pick a topic that somebody's really passionate about, and they'll talk about it for hours. And you might have, say, 6 different learning objectives in a day, and then you realise that you've spent the first 4 hours talking about the first one. Not helpful. So it does promote some of that time management as well. It also helps to align with the professional standards. So what we talked about in my little pyramid diagram earlier, in terms of what are we trying to achieve, what level are we trying to achieve in terms of the different the different contexts. So are we trying to achieve students knowing how to manage this condition, or to know about this condition? And so really being clear about the level, the extent to which the understanding is required. It can ensure consistency. So a lot of the time and I'm sure, our experience right now is that we have students who'll be going to Vietnam, will be going to Taiwan, will be going to the Solomon Islands. Students are everywhere, but what can we do to ensure that somewhere there's some consistency in skills? Those are extreme examples, but even here on campus, we have at any one time, we can have up to 16 rooms running with the same clinical skills session occurring in those 16 rooms, so with 16 different tutors. And having that work where all students come out feeling like they've had a consistent experience is really important. And so if there's a plan, then we can start to get towards that. A little bit of variability is really important, and one of our biggest challenges is sometimes explaining to students that variability is okay, and that in the clinical world, people will do things slightly differently, and being exposed to different views, different perceptions is good. They still tend to like being standardized, and they like to know that their friend who was in the room next door didn't get something that they didn't. They don't want to feel like they missed out. It can also promote collaboration and teamwork, because if I as learner A comes in and I work out with my supervisor that I've got some particular goals and opportunities, and then we go, well actually who else has got the same ones, let's work together. That can be really helpful as well. So that can be from a learner, but also from a teacher, because it can be a case of going, my learner has these goals, but I can't necessarily address those for them, but can we work together? So I'll help you out with some of the things that might help your learners, and vice versa. So it can definitely promote, and especially in a clinical environment, where you might say, and our CPCs again are a really good example of this, where we have the CPCs who might have particular areas of expertise, and they will offer to the students to run a skill session. They'll say, we'll notice some people have been asking about catheterization or whatever. One of them was running some sessions on using the slit lamp for ophthalmology, and they'll offer it to everybody. So even if it's not directly relevant to that particular learner's goal that week, it's something that they can offer to the students on site. So there's that opportunity for collaboration. Then of course there are the ones that fit both and meet the needs of both learners, and as I say, I think most of these are for both anyway, but really these are the ones that definitely are about both learners and teachers. So it's about structure, it's about the assessment and feedback again. So this, as we were talking about which comes first, but really assessment, we know that assessment drives learning. So from a learner perspective, what do I need to do to pass is a big motivator, and as much as we as educators that can be really painful, because you think this is just important, I want you to know it, or I want you to be able to do it, they still go, but what do I need to do to pass the exam? But that it can support that assessment and feedback, because obviously if we think back to the constructive alignment, having a plan, we then are able to go, well, how do we know? So part of the plan is, how will I know if I've achieved this? And it's also about being adaptable. So I think this is something that I think can be really great in that small group environment. You can't do this for every student in a lecture. What you can do is on a placement type environment, small group over a longer period, like with a group of students that you might have for say tutorials for a semester. You might come up with a plan for how you can support them, and they might each have a learning plan going into a placement over a period. They'll each develop their learning plan, and then they can self-assess as well as to, at the end, how do I feel I went with achieving my plan. So, you've all got a bit of a beginning, I believe. What we might do is just talk through. So, like I say, the Teaching on the Run model has us do, I think, pair share. So we go into pairs and do some discussion. If you're okay, I think we might just talk as a group about each of the things. So we'll break it down into each of the different components. So initially, why is time period important? Why do you think we need to consider that, and what kind of time periods do you each have to work with? Do most of you see students
Yeah. So
over a long, like a
Yeah, so-
semester.
Yeah.
traffic is important because then you can manage the time, you can manage the learning plan. So to make sure we can organize the learning activity that we have a plan.
Yes, yeah, exactly. And so it might be that, you know, if you've got a whole semester,
Yeah.
you want to kind of break down the plan into steps that will get you what you want by the end of that semester and across a period, as opposed to going, well, in this particular tiny window of time, we have to achieve all of these things. So it can be really important to think about that. And then so across an extended period,
Yeah.
how do you decide at which point in that period you
Yeah.
put particular things?
Yeah.
Any thoughts? Does anyone have that kind of situation where you're going, like, I've got students for say 3 months
Mm.
and I need to achieve all of these things, how will I space it out?
Yeah, one time.
So, and that can come back as well to some of the neuroscience, like how long, like the appropriate spacing so that the students have got enough time
To digest.
to digest and process,
Mm.
but it's not too long to forget in between. So that's a tricky balance as well. So that sort of weekly revisiting can be really helpful. It's again, that's quite different. If you might see students once a week for 3 months, whereas say on placement they might be on a ward every day for a period, and so it's quite different what you can do with them.
So for this situation, like we usually based on the experience, like if we teach that kind of thing for so many years, we know like what the specific duration, physical duration for this kind of topic, and then we can expand the duration. But I just want to ask, like, do we have any knowledge-based theory to support, like, to have to devise the span duration?
Well, I guess yes and no, in that the knowledge base or the theory would talk about the different, like, I guess it's more about different learners. So while yes, I guess it can give you the things to consider, it can't necessarily give you the answer, because the answer might be different for every learner. Like my son, for example, with his dyslexia and things like that, just needs more time. So he will get there, but you know, sometimes the pace that things might happen in the classroom might be a bit too quick for him, but the classroom pace might be just right for other learners. So I think it's
Case by case.
yeah, exactly, case by case, but considering some fundamentals. So considering the theories of like breaking down components of learning, so that and matching, and again the constructive alignment and sharing that constructive alignment with learners. I was talking with Dr. Mike yesterday about some of the feedback that we receive, and our learners often feeling a little bit lost when they might have a lecture or a forum where somebody might have deliver a whole lot of content, and on the first slide of their presentation they might put a list of learning objectives, but then they'll just go into the content, and the learners sometimes find it hard to match which bit of content match to which learning objective. So it's things like that you can do to support it, but there's no absolute right way. Those are just supportive kind of approaches, I guess. Yeah, and so the time frame depends on what time frame you have, more than, you know, there might be an ideal time frame, but most of the time we are led by pragmatics rather than ideal. So you know, here we have our 7-week rotations, so it's a case of what can you do in 7 weeks. Other universities have shorter and longer rotations, but often the longer rotations have other things integrated. So they might have a mixture of general practice or community and hospital within a 14-week block, whereas we'll have a block of 7 weeks. And there's arguments for both, because the longer exposure, more time for absorption, more time for variability in terms of exposure, there could be good argument for that. And then there's also the flip side might be, no, you get to really focus on one thing for 7 weeks if you're just doing that one thing. And probably you could take 100 learners and 50 of them would prefer one and 50 would prefer the other. So it's really, it is a bit tricky. So that's where I think sometimes the model of, by the end of a program, having been exposed to different models is really what we want to do, rather than saying this is the one way that everybody has to do everything. So that's the variability. And then it comes back to what you were talking about earlier in terms of what learning opportunities are actually available. So it's obviously very different, again, to saying I've got access to, you know, a tutorial type situation where I might have learners come into a room every week for 3 months, and I can map that out really clearly, and I can create the learning opportunities. On placement, it's a little bit different in terms of thinking, well, what is available? There's like ward observation, what kind of practice opportunities are available to them, what interprofessional opportunities might be available to them, what sorts of, in your plans, you don't have to share them, it's very, you know, informal. In the plans that you started to do in the online, what kind of learning opportunities did people include?
So we have formal and informal opportunities.
Yes.
So we can divide into two
Yep.
two types opportunities, formal, informal.
Yes, so say something that might be timetabled,
Yes.
that is, come to this session.
Yeah, just informal, just come whenever, that's, we have not planned before, not instructor, but
Yeah.
so the informal opportunities is very common in clinical rotations.
Yeah.
Yes.
What kinds of things would you say would be an informal?
For example, when a medical student go to the hospital for clinical rotation, so let's see a nursing transport the patient from this department to another department. So the student just look, okay, it is
Yeah.
informal
Yes.
opportunities.
Yeah, sure.
Yes.
And does that get included, do you think, in the learning plan?
I know.
No?
But it is the concept of the informal opportunities doesn't mean about this concept definition doesn't mean it's not included in anything. That's why.
Tricky, isn't it? So I would say, especially with some of those things that might be interprofessional kind of opportunities, that actually it's really good to include it. I've previously done a bit of work in interprofessional education, and one of the challenges with that is that opportunities do exist for students, but they often don't take them up if we don't say, hey, this is something that you could benefit from. So for example, if you think that, like, so, and you can put it in there so that it's something that you could say, this is optional, it might not have an end date. So, you know, in terms of the time period, it could be very much open, like at some point in this 6 or 7 week rotation, try to do these things, and then they might be the informal things. So that might be the kind of, observe a patient being transferred to a different ward, go to a multidisciplinary team meeting, you know, listen to the handover from the nurses in the morning, like whatever. But if you don't put it in there, students just won't know.
So what's meaning of course it's not easy for students to recognize the how to say informal learning opportunity, right?
Yeah, exactly. So I think I would say include it and it could be, the description could be broad, so it doesn't have to be this particular event on this day, but it could be any opportunity for handovers between teams, that sort of thing. And then what that does is really clarify that actually that interprofessional interaction is something that is important for them to get out of. This is something that, this is like a learning from failure, if you know what I mean. So we don't do interprofessional education well. And we send students off into placement and we think, oh well, of course they have opportunity to be learning from other professionals because there are other students around and they're a multidisciplinary team planning meetings happening and all of these things are occurring. But a lot of the time, when you say to the students, did you go? No, I didn't know I should, is often the response. Or there might be some hidden curriculum kind of messages. So I've had one student say to me, oh, well, someone told me, like, you shouldn't worry about going to that, you're going to be a doctor, that's not relevant for you. Whereas I would argue that it's so relevant to be able to learn about, you know, the rest of the teams and how they work. And so,
so, as I noticed, so informal opportunities. So the skill learning in informal opportunity usually is not assessed.
yes, true.
Okay.
Not formally, and that's a really good point. So one thing that you can do, I guess, is structure that a little bit, and it depends how much kind of influence you have on your curriculum and that kind of thing.
Yeah.
But one way to look at some of these things is to actually make it, so we have students who do, they do mini CXs, so mini clinical examinations, they do workplace-based assessments, but they also have like a logbook type assessment or a CPD portfolio type assessment. So as part of those types of things, you can say, tick off, write a reflection. Reflection is one of the things that you were saying makes a good learner. And even that can be a step closer towards an assessment of something just by simply taking something that was informal and formalizing it as well, actually I can include this in my logbook or in my portfolio or whatever the structure might be, and reflect on it, so that suddenly it takes something that might have been an incidental exposure and the student is forced to just reflect and think about it. That can be an assessment in itself. So
We look at the logbook from the ones.
Yeah.
So it's include the formal and informal.
Yeah.
Formal does mean this, the student should learn and there's assessment, and the informal obviously much more you have learned.
So I might have learnt, today I might have done a catheter or a catheter or like something that's a tangible skill. But I might have also learnt something about interprofessional collaboration by attending this meeting or observing a handover. And simply by doing a quick reflection on, this was a really helpful experience for me because I saw this, again, that can be a learning experience. So yeah, there's lots that you can include. So
And to be an experienced teachers and the clinical chancellor of the teachers, so they maybe make sure that the informal learning opportunities will occur 100% or very often in the clinical placement, right?
I think, so this again, like we talked about the benefits of a learning plan, and I think it can make it clear for both sides, for both the learner and for the supervisor, for the educator, that if a learner comes in with a plan or you develop it together, it can really help to just make it very explicit that actually, yes, this is a learning opportunity. If you're on placement, students, and we hear it all the time when they say, they might have a task or a focus in the morning, like they'll say I might be on the wards in the morning, but then in the afternoon I'm just, they'll say I'm left to my own devices or I just, whatever. And some students will just use that time to go and study. Other students stay in the clinical environment and take the opportunity for these kinds of things. And I think if you've got it on paper, then the learner can go, actually this afternoon where I'm not, tasked explicitly with doing something that might be timetabled or really clear, this might be my opportunity to go and observe an MDT or go and just have a chat with a patient and take a history. And then equally for a supervisor to say, this is on your list, actually. Just, and because otherwise they might not let students know that there might be things coming up. So they might say, I'm done with ward rounds, you can go. But they might say, actually I am done with ward rounds, but there is this other thing happening this afternoon that might meet one of your other needs. And so it just makes it explicit, which I think, for everybody is good. So it comes back to the expectations, I guess. Which is one of the the things that the students really initially on their first clinical rotations, they talk about, and it's team based. So some students will go into teams where they're very supportive and the supervisors are experienced and do a great job of making them feel welcome and understanding what they should do. And then others talk about feeling like they're kind of shoved in a corner and just trying to stay out of the way, which is not what you want for anybody. So a structure like this can just help even as part of orientation to say, hi, okay, yep, you're our student with the team for whatever period. Let's sit down and make a bit of a plan for what you're going to achieve.
Yes, very interesting.
What you in a case like, if you develop the learning plan and then for the goal for the student and you think it's important for student, but like one student they don't think that it's important for them, like they don't want to follow your learning plan and they switch to other class, so.
Yeah, look,
What do you do?
There's always going to be some, and I guess it just depends how rigid, like how closely it aligns with assessment, say. So if it's if there are some things that are part of formal assessments, like, mini CXs and MBAs that need to be signed off at the end, then those students don't get signed off. Yeah. But I would always say you have that conversation before the end. So before it comes to sorry, I'm not going to sign you off on this assessment, you have to have an opportunity to say, let's check in and give the feedback. Because that's something that, you want to give them the opportunity to change that attitude and behaviour if they can. So there are always going to be some learners that will do the bare minimum, is bare minimum to pass. But I guess that's where if you can create minimums, like even in our CPD portfolio, we have a point system where we say, okay, you need to get 100 points in each of these areas every semester, across the different areas in every semester. You can get more points than 100, but the minimum is 100, and that just means that you've done all of the things that we think you really need to do. And then some students who are doing extra, attending everything, submitting their reflections on everything, maybe doing some additional extracurricular work. So we have students do 12 hours of volunteering in their first year. Some students will do more than that because they might volunteer anyway, or they might start the volunteering and do their 12 hours with an organisation and discover how much they love it, and start doing more. And so those students will then submit a reflection on that, why they've chosen to do more, and they'll get extra points, and that's great. But then all of them will meet that bare minimum. So you can kind of do that where you're trying to say, this is the absolute minimum, but then, the motivated students are the ones that are going to, and they're I guess more setting themselves up for career, development and making them competitive on their CV, as opposed to just passing the course. So yeah, that's the difference.
Yeah,
As I
think
know,
it's related to like how to develop the intrinsic motivation. So like when we set the minimum score that we need to achieve, like provide them the intrinsic motivation, but yeah, to have them to have passion and motivation by themselves, like intrinsic motivation, have them strive.
Yeah, and it is really difficult. I think medical students in general, lots of them have it because they want to do well. They want to be very successful, and so a lot of them will. But there will always be that group that want to do just enough. And the last, exactly. The ones that come in late and leave early versus the ones that are always attend. And so I don't know. That's kind of like utopia where we all sort of find the answer to that. But I also think that it's okay to have that range. We can't expect that everybody will do, absolutely everything. But what we need to know is that they've all met the minimum. Like if we're going to graduate, someone who's going to go and treat patients, and this is what I say to students, even in the context of attendance, because we have an attendance policy, and students who miss more than a buffer that we allow might not be allowed to sit their exam. And they see it as punitive, like, as the stick. But I say, well, for me, I want to make sure that you've been exposed to the learning for a start. It's not about just making sure that you tick the to be exposed, and that includes the informal exposure.
Yeah.
Because we can timetable sessions, but a lot of the time it's the conversations that happen between the sessions with your educators, with your peers, those sorts of things that are the gold as well as just what's delivered. So there's the exposure, and I always say as well, if I, take my children to a doctor, I would be really scared to think that that doctor might have missed a quarter of their medical program, and they might only know 75% of what they really should know. Should I go to 4 doctors just to try and make sure that I get the right answer? No community member should have to think like that, and so that, when I put it to them like that, they sort of, maybe a little bit right. I should just, try to develop that intrinsic motivation just to know stuff, more than just to pass the exam, but who knows, it's a challenge. I'll flick this to the next, so the next bits are the sort of, the goals. So the goals and opportunity, so that the purpose of each opportunity. So I guess this is partly what we're saying around, there are lots of informal opportunities, but if we can formalize a little bit and maybe show that actually there is a purpose or a benefit for them, that can be really helpful. And then what will the learners actually do? So say, and I think this yeah, or is it observation? Are you going to observe?
Yeah.
What do students do if you tell them to just go and observe?
Okay, so I used to just tell, okay, please, you just please observe this procedural skill and to check it is fit to what you have absorbed of the knowledge on it.
Yeah. So you give them something more than just watching.
Yeah.
Because
I think like it's active and passive also.
Yes, exactly.
Passive means let's just look at it.
Yeah.
No meaningful, nothing.
Please observe this procedure skill and tell me which step I'm doing and this and that.
Yeah. So giving them something that is, and warning them as well. I'll ask you after you've observed it to tell me, to give me some feedback or to ask me a question. So you want them to be coming up with a question while they're doing it. Or I want you to go and observe this meeting and then do like a handover to me. So it might be that there's something that you are not part of or present at, and you can say, I'd like you to do, an ISBA style handover back to me after you've observed this thing. So again, there's not just sitting there feeling like, and again, quote unquote, trying to stay out of the way, but actually actively involved. And I think that's so that's what the learning plan I think can do as well, is to really make explicit that what do I want you to do in this, because I think otherwise you might just almost easy to make a flippant remark to a student, go and sit in and observe something, but okay, I need to think that step further of if you're going to observe it, what do I want you to do? It might be handover, it might be a write a reflection on it, it might be come and feed it back to me, do a patient note summary, whatever is going to be helpful for their, again coming back to their objectives, what are they trying to get out of the overall. And then of course who's responsible. So just, it might be being really explicit about this is a learner, or do we need to talk to the nurse unit manager to help identify a patient for you to talk to, who needs to be involved to make that happen. And again, just being explicit so that you can say to the student, this one's on you have to drive this, or these are the people that you should talk to about this is who you should feedback to. And just kind of does that fit? I know you've all sort of had a look through the module. Does that fit with some of what you came up with? Have you ever used this kind of structure before?
We have not used this platform before, but so during clinical training, so we do something but not too clearly, So I think it's very clear and it's let us know.
I think it's worth, it's funny because it's one of those things that you can very easily go, yes, this is a great thing to do, and then you forget to do it. But in some contexts, to sit down with a student and really work out, it won't always work, especially if you've got big groups and, different formats. I think it's also particularly good, say, for a remediation type opportunity. If you've got a small number of students who need supported remediation, then this can really help structure the conversation that you would have to say, what are your gaps, like what, in terms of identifying the learning objectives, like what feedback have they had, what have they struggled with, what are the gaps for them that you need to try and address, and then working into, okay, well, how can we address those gaps for you? So that can really help. And this is, again, our CPCs have done this and tend to use this. They're trained in some of the coaching principles as well, and a bit like, behaviour change models and that sort of thing. And really this can help support that because it helps prompt some of the questions. Sometimes the learner themselves will be able to come up with a lot of this if you ask the right questions. And so they can drive that themselves.
It's not helpful also to put the assessment in this platform, no?
Yeah, it can be definitely. So I guess it depends, again, it depends on the context. So a lot of the time, assessment, I guess there are two types, mostly say if we're talking about placement and we're talking about workplace-based assessment and a mini-CX, then that would be definitely like a task. You could sort of say it's an assessment task, and that's a very explicit sort of thing. And then there might be others that might be more of a formative type activity that you need to do and maybe tick off, but it's not a summative or structured assessment the same way. But yeah.
Because it's the big difference about the clinical correlation assessment that you hear and the Fashion University. So as I know, here you apply to EPA and there are 4 skills for in clinical assessment, right? It's very bad to again but in Vietnam, so we have the assessment and finally we have a score from 0 to 10. So you know what I mean?
Yeah, and it's very different, I guess. You still go in that scoring system. You to decide what's the minimum. So do you have to put a line to say a learner at year 3 level, maybe a 5 is enough, but at year 4 or 5 level, they have to get at least an 8. I don't know. So that's, I guess, the thing to differentiate.
It's like they need to have above 5 for every subject.
Yeah.
And sometimes it is not really good to have like the same for apply for every subject, but it's like from the pre-C.
Yeah, it is tricky. We have a similar sort of structure where students need to pass the different categories of assessment. And so, that's like the written assessment, the clinical practice. And it is interesting because you see some students who are very strong in some areas and not in others, and so that can be okay sometimes if it's a case of say across an OSCE, if some students are a bit weaker in general medicine type things and then stronger in women's health and whatever, maybe overall that's good enough. But if it's a case of they failed the exam and so their content knowledge is really poor, but their clinical skills are great, or vice versa, then that's a bit problematic because they kind of do need both. Then you need to be able to apply both. So it's that structure, that assessment structure can get quite complex. But yes.
We discuss more little about time periods because clinical remediation is a real one. For example, in the time periods, we just don't know, okay, this week you reach a MI patient, but unfortunately this week there's not the MI patient at the hospital and
So so that's this says, stayed in days, weeks or sessions. So it might be that you say sometime over the next week you should try and achieve this.
okay.
Maybe it's like week 1. So you might have, if it's that sort of thing, placement type thing, it could be day one, you're going to do this, or it could be week one, I want you to try and, do these sorts of
With
things.
students, have to be scheduling in to modify.
Yeah, exactly, so sometime in this week,
Yes.
do this, so
Okay.
it might be attend a board round, attend this, or, take an opportunity to see a patient, like if it's say more of a general practice setting, it
Yes.
might be, you can never know who's going to come in the door,
Yes.
but you might say across a week, we can guarantee that there'll be someone who comes in with a sick child.
Yeah.
So let's assume that in a week, you'll be able to see take a collateral history from a parent with a sick child, or,
Yeah.
whatever it might be,
Yeah.
you've done something.
Because I noticed, so when we work, one students, so when they go to the Vietnam for clinical operations, we have to work with them to make sure that they have the highest opportunities to meet the operation.
Exactly, so it's, gotta be there has to be
Yes.
some flexibility
Yes.
in this, I think, but, it can depend on
Yes.
the context, like, classroom structured,
Okay,
on campus course versus a placement is quite different.
Yeah.
Yeah.
Very
And
interesting.
even tutorials, so I began working with a core team, so with integrating the core subjects into medicine, I realized that we in medicine tend to be very, there's just so much, there's a lot of learning that students have to do, so even teaching, more of the social sciences, I tend to use the time, we have we'll have some didactic sharing, some discussions and activities, but it's always active. And in core, there's a lot of, today we're going to spend the tutorial drafting your assignment, or whatever, and I find that interesting, it's a different way of doing things, and as a learner, personally, I would tend to go, if that's what we're doing, I'd rather do that somewhere else, not in this tutorial environment. So we have to, think about what the structure is, and I would tend to go, okay, if I've got 12 weeks of tutorials, this is how I'm going to use them. And sometimes, spending some time drafting and observing the work as it's being created might be appropriate, but other times it might be what activities are we actually doing in each of those, so vary.
My last question for this section. So,
My
I know,
last question too.
I know that Mount University has the shortest, MD program that to get the degree, and then it's been like, this will be the intense program. So it's been like a lot of workload and study load for staff and for students. So do you think like, what will, it is affect the way you develop the learning plan and everything else, like, how
I
you
think
cope with
that's-
that? What the strategies?
It is very intense, and it's, I guess, it's more like we do 3 semesters, so it's really just that other universities will do 2 of what we do, squeeze 3 into the year. And a lot of the time, our CPD portfolio now with coming in first year and then carrying through, I think a lot of it is that actually, a lot of it is helping students to learn how to learn how to manage their time, and actually develop their own plans and learning strategies. So, you kind of have to let them not fail, but let them try initially independently. Because even if they've come straight from school, they're very high achievers, they've performed very well in high school, they think they're like, I'm gonna be a doctor, I've got great scores, I'm gonna smash this. And then they start studying medicine and go, whoa, this is hard, and there's a lot, and and even ones who have done other degrees, because they're used to subjects that might have 1 tutorial, 1 lecture in a week, and some reading to do, and then they come here and it's big, and it's integrated. They do struggle, and so we have phase leads or student support leads that really help out. So we have a student support lead for each cohort of students, and a lot of their job is discussing with students how they study. So they do a lot of the pastoral care, pastoral support, but they also have lots of discussions around, okay, well, if you're struggling, if you're finding it hard to learn, what are you doing? How are you, revising your content? What's your study approach? And so coming up with a bit of a study strategy and a learning plan with those students is something that we really try and encourage them to do. So, and the CPD portfolio now formalises that. So in the second semester of first year, after they've had their first set of results, for some of them, there's a bit of a shock because they go from being really high achievers to, not performing so well. And that's then a great opportunity to say, okay, what are you going to do differently? How are you going to approach this? And we actually give them some structure to come up with their own, not so much learning plan, because in year one, second semester, the learning's laid out for them, but the study plan, so how they will kind of tackle that as a big piece of work.
So with that intense study load, do you have any strategies for the learning behavior, like
So
promote?
yeah, so I guess what we try and encourage is just that they stay on top of it, so that they are constantly, like, not just passively attending things and revising forums. We talk to them about when they go to a forum or they watch a recording of a forum or a lecture, that they are not just, so some students will say, if you ask them how they approach it, they'll say, I just write down everything that the lecturer says. And that's like, well, I will do that for the first couple of minutes, and then I'm way back here and the lecturer's down there, moved on, my hands can't keep up, and my brain certainly can't keep up. So what we try and say is, okay, what's the better way? So generally the slides, the resources would be available to them prior to the session. So we say review them beforehand, come to the session knowing what you're looking for, knowing what the session's going to be about. So you've got that preparation, and then start thinking about when you're in the session, instead of just writing notes, because you've always got the resources and the recording generally available. So instead of taking notes, write questions, or identify the gaps. So you're not just you're more actively absorbing, but also actively doing something, a bit like we were talking about, rather than just observing a physical examination. Observe it with a goal. So if you go in and say to a student, well, actually, I want you to write questions, as in write questions for the educator, or even your goal is to think of 3 or 4 exam questions by the end of this session. They've got some sort of more focus. So that's one that we try and do. And then the other is things like we do provide them with lots of resources and things like practice questions. So we have online Quiz, which is like opportunity to do practice questions, which are a bit different format to the MCQ often, but they still allow them to test their knowledge. And so those active forms of learning, rather than just reading study notes. And like the students who are preparing often for a resit exam, when they've failed the first time round and they're getting ready for a resit, you say, what are you doing? I'm just going over my notes. And so what do you do that's more that you can do that's more active than that? I mean, I feel like as a learner, I wish I had my time again. Having done biomedical science, I feel like I have recollections of hours and hours of just doing exactly that, going over notes and sitting in lectures and taking notes. But I would do it very differently if I was doing it again now, and that's, I guess, what we know more now, so we're able to support learners to be actively involved.
So in here, if the student fail the exam, they have second chance to take it again?
Yeah, generally. So it's not automatic, but if they've performed well enough on everything else, so how I said they have to pass each category. So if they've done well enough on, say, the clinical practice and on everything else, but they fail the exam, they would most likely be eligible to have a resit opportunity. But the resit covers the whole year of content. So the resit is at the end of our subjects are semester based, but it's a year-long subject. So we have 1 point of progression into the next year. So the resits only occur at that point of progression at the time when students are ready to go into their next year. And so if you have to do a resit, say at the end of your second year, instead of it just being about that last semester of content, you actually have to do a resit which covers the whole year of content. So it can be really hard, but it's also then that assurance that if a student passes that, they actually have got a grasp of a whole year's worth of content. So you never want to have to do a resit as a student, like it would be stressful to have to sort of study for that.
So from the behavioral science, I promise this is the last one.
Good, this is good. If everybody else is happy, it's okay.
So from the behavioral science, do you think like we should provide them a second chance to take the exam, or just one time? So like they will put all the effort for just one, so.
One.
What do you think?
I think giving them that second chance gives them a chance. It's not about remediation, so it's not about giving them more time to learn. And this is where some students complain when they say, I only found out that I needed to do the reset a couple of days before it. I didn't have time to study. And the argument is you should have been prepared. You should have been studied for the initial exam. And we always say if you think you might be needing to do the reset and study, but the principle is still they should be ready. It's not about saying go learn all that stuff that you hadn't learned. You know, it's a year's worth of content. So it's not a case of cramming it in. It's a case of saying you might have had a bad day. You might have, this might have been a blip and an aberration in your pattern of performance. So we want to check that. We want to, it's almost testing that the data is accurate more than it's testing, whether they actually, so we want to go, well, let's assume that you might have the knowledge and we'll give you a second chance to demonstrate that you've got the knowledge as opposed to go and cram and try again. So that's the sort of the argument that, it's tricky because we're trying to promote the long-term retention of knowledge rather than that, short-term learn and cram and forget cycle, which is tricky. Which is why they do programmatic. They do progress tests in MD, so the assessment is sort of blueprinted on the same content. So they're studying for everything for the whole time and continuing to develop and what you should see is their marks kind of improve over time.
Yeah, so even though they learn how they have 3 semesters per year, but I saw them very happy and very refreshed. You also know that they have a good night always, right?
It is funny.
So it's different from the Vietnam, so
oh, really? Your students not happy?
Compared to the
Oh,
students,
come on. I think Vietnamese, I feel like every Vietnamese person is always bubbly and happy. But I think the thing is that at a lot of medical schools that even are not so intensive as Bond, generally by the time you get to the clinical years, they are doing a long year anyway. So at Newcastle, our first and second year students did a more traditional 2-semester model, which went from sort of February through till October, November. But once they got to year 3, they started in January and went through anyway. So they did finish a little bit early at the end of the year. That's one thing here at Bond that we all kind of find we're all ready for Christmas. But we're working right up to, we often have Christmas Eve or the day before Christmas Eve, the Board of Examiners for the assessments are being finalised. So it's a lot. So that is later, but generally that early start's pretty common for most medical schools in the clinical years anyway, just to fit it all in. So it's only the first 2 years that are too much different. I mean, you're seeing the ones that are here. I think that's the other thing. So it's not to say that they're not happy, but I met with a student yesterday who was requesting to withdraw from the semester and take a break because he had to repeat year 2, so he's just done year 2 twice. He passed the second time round, but he's exhausted. So he's just started year 3 and he's reflecting and saying, I actually need a little bit of time to myself before I properly continue on this, which I think is great. Great insight. So it's that case of, especially students have to do the resets. So the students who finish in the normal semester at least get a few weeks off in between, and it can be up to a month. So it's not horrible. They get time to go home wherever home is, see family, travel. So it's they get more time off than we do. So it's okay. But the ones that have to do the resets are the ones that do struggle, and the problem of course is that those are the students who are struggling, and so they then get burnt out, or they risk burnout, because instead of having a break, they finish the semester and continue to study for the reset exam so that they can progress, and so they haven't had that time. And so that's why when a student like this one yesterday comes to us and says, I'd like to withdraw from this semester and take a break, and he's in a window where it's okay, he can come back next semester and start year 3 with the next cohort. Go and spend some time with your family, do whatever
Yeah.
you need to do, and I think that's important. So, yeah, the majority are okay, but
But always,
there's
anyway,
always some,
yes.
yeah, definitely. And I guess that's part of the learning plan as well, that, you know, why it's so important. Alright, we're gonna come back to our little memory activity. So all of you saw all of the prompts. I'm going to give you a few minutes to sit and try and remember as many as you possibly can.
I forget all. Could you help me?
No, that's not the idea. Individual work, please.
Write down.
Group
We have to
work
write
or
down.
individual?
No, individual work,
Individual.
no,
Oh,
individual,
no.
every individual, and then I'm going to show you, and we'll, yeah.
No.
It's not a test. I don't have a prize or anything. Just waiting for the time. This is my kids having school.
Very nice.
I'm just trying to find the.
The same bread, the same bread,
The
right?
same, yeah, yeah, so
Oh,
this
very
was
nice.
a good place, it's like a, in the outback, you see the red dirt,
Absolutely.
very red. It's very northern Australia, that was the scones. Are we still going? Still thinking? Emmeline. I feel like I would fail sometimes, those tests for, you know, Alzheimer's or memory, remember this number. What was it again? There's a lot to remember. Alright. Finished? We'll stop there. We'll stop. So, I'll show you, and I'll tell you, I want you to then tell me how many you have correct, but just in general, how many do you think you remembered?
So we all know.
On the one?
Maybe 3.5.
Okay, 3.5.
I have 3.
Okay. How many do you remember, do you think? Okay, yeah, that's okay.
I write down 5.
Okay.
But I'm not sure.
But no, but check if they're correct.
I write 11,
How many
but
did you write
10 is
down?
not correct.
Okay, 4 or 5. So already I'm seeing we've got sort of 4 or 5 on this side and maybe, you know, 1, 2, maybe 3 on this side.
Yeah.
the point here is having a structure, a context. So these were the things. Now you can tell me how many of them are correct. Beach is a good place. You had one correct?
The beach is beautiful.
No, close. It's close.
It's
Close.
correct?
Okay, that's correct enough. Close enough. What was, you get any? Yours were correct. Your two and three, five correct. Good. Four correct. And how many correct? Two. Okay, that's alright. I think it's also probably English as a second language is hard because they're kind of nuanced phrases. They're a little different. The reason that sorry, I thought there was another slide there. Hi, Michelle. That we're nearly finished, so I'll just wrap up. The reason that you guys had more is like they knew this is about flying a kite. So they had that context, and you guys didn't. And it's so much easier if you now look at that list of things. I can look at it and go, oh, yeah, of course. It all makes sense because it's all connected to flying a kite. But when you're trying to remember those as isolated phrases,
No context.
exactly, no context, no connection, then it doesn't make sense. So I guess that's that whole bringing it together into a learning plan and the idea of giving students the reason, the structure, those sorts of things. So we'll just really quickly, I think we've had a really great discussion and we've covered most of this, but the great blueprint. So you talked about the assessment and how do we assess. We blueprint assessment, so we sort of map, and that constructive alignment diagram I showed you is all about that, is about saying, are we making sure that we're giving you the opportunities, exposing you to the learning that you should be exposed to in order to then assess. So that's that sort of idea of a blueprint or a map. It does require buy-in, as in from both the learner and the teacher, embedding in assessment, and obviously then engaging staff is really important. And it should be collaborative. It should definitely be a partnership so that the learner is part of it to help self-identify things that they think they need to focus on. Obviously it has to be supported with opportunities. So if a learner comes up, you and a learner might come up with a whole lot of things that they need to cover, and then you think, but this is not part of, I don't have anything, this is not part of what I was planning to teach them this semester or what I can offer them, then that's obviously going to be a problem. So we need to make sure that it's linked with that. And it is going to need to be flexible and be reviewed. You know, especially if it is something that is over a longer period of time, you might want to revisit as things are going and just sort of check in, like you were saying, what about the learner who's just not interested and doesn't engage? You do need to review and say, well, where are we up to? Do we need to recalibrate our expectations? You know, is it them? Is it the expectations? What's not quite working? I think we've really covered a lot of this. So the challenges and solutions are the last sort of part of this. So some people will say that there's limited time and resources, but in terms of like sitting down and having a conversation with students about the plan, I think that's the investment in time. But it's again so much aligned with a patient interaction in that if you invest the time early in building some rapport, understanding the agenda, the patient's agenda, your agenda as a health professional, then it's an investment in that consultation working really well. So people might think that, oh, building rapport can take time. Usually it actually saves time. And so I think this is very much like that as well. Sit down with the learner, come up with a plan. But then also, you can align the plan with things that are already happening. So it's not about going, I need to teach extra sessions, I need to do additional tutorials or anything specific. It can very much be, these are things that are already happening. There can be some resistance to change, but obviously if people can see the benefits, then you know we can convince them eventually, and especially if we can show them the benefits for their workload, their satisfaction. Sometimes clinical supervisors who see it as a burden will have that attitude, but actually once they realise that they can maybe get a bit of enjoyment and satisfaction out of that role, it might be more beneficial for them. we do need to provide PD and training for staff, so that's where these types of modules and sessions can come in. The unpredictable environment, we talked about that in terms of saying, well, okay, instead of saying today or in this hour you must do this, we can say over this week. The very tough style, so it talks about flexible plans, having a list of opportunities as opposed to, prescribed specific things. There might be limited engagement from learners, we definitely talked about that. Discussing the plan, embedding the assessment, because we know assessment drives learning. The assessment and feedback, so again, training the staff and embedding that, so it could be a portfolio or a reflection, it doesn't have to be a formal assessment in the same way as you think of a lot of other things. There might be limited interprofessional collaboration, and we can definitely try and foster that and make that a normal part of practice. So, we've raised that last bit, but I think that was because we had such a lovely discussion. And we've got to this, so this is the one where it's more about that, a bit more didactic and a little bit of discussion. But Michelle's here now, so the two that we'll do this afternoon involve you a lot more. So you'll have the opportunity to do your micro-teach and your skills teaching. But hopefully we've achieved these things. Tell me now if we haven't. Have I missed something? But we had lots of questions. Do we have any more that I haven't? No. Okay. So what we might do is end there. So you can, that's the little code to get your certificate for that module. So I've got certificates for you, bond certificates today, which will cover all three, but you can also get your teaching on one health centre certificates for each of the modules individually. So I'll leave that up. Lunch will be coming in a little while. Michelle's here and others will arrive for lunch as well. But I thought I'd just give you this time to think about. So Michelle, you met everybody the other day, didn't you?
I saw everybody.
Yeah.
I only met a few of you, but I'll introduce myself over lunch as well.
Yeah, so as I'm co-head of Bachelor of Medical Studies, Michelle's co-head of the MD with Mark Morgan. Michelle's going to do the skills teaching the second part. Clinical teaching. I keep doing that. I'm doing skills teaching. But yeah, so what we thought, because we've just got such a nice small group, we might just do 2 and 2, as in I've sort of said, think about who we'd like to present in the first one, and we'd like to have a go at the skills teaching rather than everybody being put on the spot and going through. So thought we might be able to use this little bit of time now just to get yourselves organised for that, decide who's doing which, and if you want to prepare anything, do that, and then you can have some lunch.
Yes, this lunch is at 12. Is it in this room?
It's in this room, so they'll bring it in.
Yeah, you might also want to break
Yeah,
before
you
that
can
as
go
well.
outside and get some fresh air, although how fresh is the air out there?
It's warm, but there's a breeze, so
Yeah,
feel free to
okay.
stretch your legs. Do you know where the bathrooms are?
Yes.
Yep,
Yeah.
probably more. I couldn't find the room. I've not been to this one before. So, and there's the information on the micro teaching. If we didn't get a chance, so you can have a look at that's the activity we'll do in the next one. So feel free to have a look at that. And did you have a handout for the skills one?
But not for the skills one, I don't, but if you want to have a look on the,
And did any of you come prepared to teach a skill?
Yeah, they are doctors, so.
Excellent.
They'll teach a skill.
Excellent.
You could teach a physio.
It doesn't
Yeah,
have to
yeah.
be.
If
a-
you'd
it
like an
doesn't
ankle
have to
to
be a
strap, I
medical
can
skill.
provide one.
The last time I taught the skills one, I taught everyone how to tie a bowline, not, so the important thing is not what you're teaching, it's
Yeah,
how
exactly.
you're teaching.
I always do a yoga pose.
That's a question, because like yesterday, I discussed with my college in Vietnam, who will be the clinical instructor for Bond's university students in the next time.
Yes,
So they told me that, so it's very useful if they will be trained the course for clinical teaching from Bond University.
Yes,
yes,
exactly.
And the question is, I don't know, so now we have to participate online, your course now this afternoon, or maybe we discuss to organize later.
We're going to run through, we've got a new group of tutors starting shortly, clinical placement coaches. We're going to do a lot of these sessions with them. With some, I think they'll probably be online, so it might be better because it's more useful if we've done the online module first. So we're happy to help facilitate that. I just have to give Connor a handover about the focus group she's about to run. So
I
I'll
will
just do that
see you all
quickly.
really soon. I'm
You're
leaving
free
right
Yes,
here.
and
Oh,
you
I'm
leave me
logged
logged
in.
in, I leave me logged in because I'll
You
have
can
to
get
get
some
the video
Yes, I'll be.
and slides and stuff. Are you in the Teams?
I'm not, but yeah, well, yeah, if you need to, I've got yours.
Bây giờ tới độ được cái sinh viên của em thì họ sẽ set up một cái chuyên học online cho các bác sĩ của mình.
But if you're in your everyone.
Các bác sĩ vô mà mình không người đó chỉ biết mà bạn không biết nào.
Thank you all, I'll see you soon.
Yeah, thank you very much. See you.
I like the strawberry.
Strawberry nut.
I have no strawberry nut sugar.
Green, okay. Yeah, that's fine. What?
This was probably on this stress around this, I was trying to work with, so, it's a coffee and stuff, I will try and.
Yeah, I've got a bag, so when I just park and leave back, it's
When
ready.
you come out of the multi-part, so when the placement care is right, so
Yeah,
to make sure facilities county. And then the application will be the turn to the right, and
Yeah.
the next will be.
Okay, that's possible, no problem. Canada, I think.
Pretty sure it's level 2.
Yes.
And then it comes, so when
Ching,
you come
ching.
below, we're going to
Ching.
turn left, you turn left,
Okay.
and then into the space.
Yeah.
And
We'll
then
see.
right.
Should you do different?
Well,